Professor Gupta, as someone who's helped build India's drug monitoring system, how did this slip through every layer of regulation? Why I'm asking you this is, what does this say about our pharmacovigilance and the network if a syrup with 48% DEG reaches our children? Professor Gupta.
I would just like to make it very clear that DEG or EG, if it is more than 0.1%, it is not acceptable, regulatory. But also even 0.1% should not be there. Number two. Number three, when you say 48.6%, it cannot be contamination. It is certainly intentional or by intentional for the purpose of getting monetary benefit. It cannot be simple contamination. Next, that these are the high risk contaminants or high risk impurities, and it is very well in the policy that all formulation which have high risk contamination possibility must be checked at the time when the raw material comes, at the time when the batch is released. All batches must be checked. Now, this is a complete failure of observance of GMP. Now, this GMP, which is a mandatory, and such cases, the punitive action should be such that these organizations, these companies should never ever be allowed.
But Professor Gupta, does the punitive action actually work? My apologies for interjecting here, and I by no means want to put you on a spot here. You're just the right voice with the kind of expertise to answer these kind of questions. When regulators turn a blind eye to serial offenders, then that's where the punitive measures come into place. Does that point to incompetence or complicity? Because I'm trying to understand, there's clear-cut nexus, some sort of collusion is happening. And how often are the same drug manufacturers caught, they're warned, maybe sometimes punitive action is taken, and yet they continue to operate in the same fashion?
I won't say this is a collusion unless there is an established evidence for that. Because
there are no reports out there, sir. 24 children have died. Look at how delayed our response to this entire aspect is.
Law will take its own course. He has to be arrested, no doubt about it. But then law will take its own course. That is definitely. And if I am the lawmaker, I would suggest that the law should be such that it should be the most deterrent for others also, and most deterrent for any person. At the same time, I will also like to mention again and again that doctor ki utni galti nahi hoti. Is not at that fault, doctor, because he needs a continuous medical education at the most, you say. But it is the formulation, the preparation which must be there. Correct. And it is poisonous, such poisonous formulation in the market. I think they must not be tolerated.
All right.
There has to be. And you said that number of staff to do the collection and to do the checking need to be augmented.